Today we are going to learn about reflexes. The definition of reflex. Reflex is an involuntary response to a peripheral nervous stimulation. Please note it down. It is involuntary response to a peripheral nervous stimulation. It is a type of protective mechanism. The purpose of reflex is mainly protection. Now coming to the reflex arc. The pathway for a reflex activity is called reflex arc. A simple reflex arc, it has got 5 components. Number 1, receptor. A receptor which receives the stimulus and generates the impulse. Number 2, that is efferent nerve. The efferent nerve, that is the sensory nerve which transmits sensory impulses from the receptor to the center. Number 3, center. That is, the center is located in the brain or spinal cord. The center which receives the sensory impulses via efferent nerve fibers and generates motor impulses. Number 4, that is efferent nerve. Efferent nerve which transmits motor impulses from the center to the effector organ. Number 5, that is effector organ. This effector organ may be muscle or a gland which shows the response to the stimulus. This is the picture of reflex arc. See here, stimulus is coming here, so it is a receptor is receiving the stimulus. Okay, so this is the receptor, sensory neuron. This is the integration center. This is the integration center. This is the spinal cord. This is actually motor neuron, and that response is reaching through the effector. So repeat, receptor. First is the stimulus, receptor, sensory neuron, center, motor neuron, effector. We get the response. That is the components of reflex arc. Classification of reflexes. How this reflex can be classified? Depending upon the number of synapses involved, it can be classified into number 1, monosynaptic reflexes, or number 2, that is polysynaptic reflexes. What do you mean by monosynaptic reflexes? Please note, monosynaptic reflex, it has only one synapse in the reflex arc. Example for monosynaptic reflex is stretch reflex. That is actually in case of knee jerk. Knee jerk is the best example. Knee jerk is the best example for monosynaptic reflex. Now, what do you mean by polysynaptic reflexes? Reflexes which are having more than one synapse in the reflex arc, we call it as polysynaptic. Poly means many. Polysynaptic reflexes. Example for polysynaptic reflexes, one of the best example for polysynaptic reflex, that is withdrawal reflex. Now, depending upon whether inborn or acquired, it can be classified like that. So number 1, unconditioned reflex. Unconditioned reflexes. Natural reflexes. Unconditioned reflexes are natural reflexes which are present since the time of birth. Natural reflexes which are present since the time of birth. It's an inborn. Okay. Example, Reflex salivation when any object is kept inside the mouth. So there will be reflex salivation. That's one of the classical example for unconditional reflex. Number two, conditional reflexes. Conditioned reflexes which are developed after conditioning or training. Please note down, this conditional reflex needs some training. So that's why in simple word we say it is developed after conditioning or training. Example, one of the best example for conditional reflex, that is reflex salivation by the sight or smell or thought or hearing of a known edible substance. Please note down, it is known, it should be already familiar, it should be familiar to a person. So this way, hearing of a known edible substance. So that's one of the classical example for conditioned reflex. Depending upon the purpose, what is the purpose of this reflex? Based on that, it can be classified into flexor reflexes or withdrawal reflexes. Another one, that is the extensor reflexes. Now what do you mean by flexor reflexes or withdrawal reflexes? These flexor reflexes occur in response to a painful stimuli which is resulting in flexion at different joints. Okay, here actually this type of reflex is occurring because of the painful stimuli. Okay, so painful stimuli, it's inducing this type of withdrawal reflex. Another one, that is extensor reflexes. These extensor muscles contract during these reflexes, resulting in extension at joints. I'll repeat, the extensor muscles contract during these reflexes, which resulting in extension at joints. So that's basically extension of the joints. So that is extensor reflexes. Now coming to the clinical classification, how clinically these reflexes are classified. Number one, superficial reflexes. Number two, deep reflexes. Number three, visceral reflexes. Number four, pathological reflexes. Now coming to the superficial reflexes. What do you mean by that? Superficial reflexes? The word itself is giving the clue. The superficial reflexes are the reflexes which are elicited from the surface of the body. These reflexes are the reflexes elicited from, example, cornea and conjunctiva of eyeball, or mucous membrane reflexes, or it is arising from the skin. We call it as cutaneous reflexes. These are all the examples for the superficial reflexes. Number two, deep reflexes. Deep reflexes are elicited from deeper structures, that is beneath the skin, example tendon. These reflexes are otherwise known as tendon reflexes. So please note it down. Tendon reflexes are nothing but the deep reflexes. Number three, visceral reflexes. Visceral reflexes are the reflexes arising from the pupil and the visceral organs. I repeat, visceral reflexes are the reflexes arising from the pupil and the visceral organs. Visceral reflexes are pupillary reflexes in which the size of the pupil is altered. There is actually, example, there is constriction of the pupillary reflex. Another example, carotid sinus reflex, in which the pressure over the carotid sinus in neck, which is due to tight collar which decreases the heart rate and blood pressure. The people wearing tight collar, okay, it can suddenly elicit this carotid sinus reflex. So these are the examples for visceral reflexes. Number 4, pathological reflexes. Pathological reflexes are the reflexes that are elicited only in disease conditions or the pathological conditions. Pathology means actually abnormal conditions. Example for pathological reflex, Babinski sign. This is actually Babinski is the name of the scientist. Babinski sign. This Babinski sign, it is the abnormal plantar reflex. Okay, we call it as Babinski sign. It is also called as Babinski reflex or phenomenon. In the normal plantar reflex, a gentle, how it is elicited? In the normal plantar reflex, a gentle scratch over the outer edge of the sole of the foot, which causes plantar flexion and adduction of all the toes. But in Babinski's sign, there is dorsiflexion of great toe and fanning of other toes. Babinski sign is present in upper motor neuron lesion. In case of upper motor lesion, we find this abnormal reflex, that is the Babinski sign. Okay, so we will discuss in detail in the future classes about the upper motor neuron lesion. Just now we just remember it is actually elicited in case of upper motor neuron lesion. Physiological conditions when Babinski sign is present are infancy and deep sleep. In case of infants and during deep sleep, it is actually Babinski sign. It is actually normally present. It is not abnormal. It is normal. It is accepted. It is present in infants. Why it is present in infants? Because of the, please note down why it is present. It is normal. Babinski, even though it's abnormal, but it's normal in case of infants because not because of the non-myelination of the pyramidal tract. That's the actually which one? It is the nervous system tract. Okay, so that is the myelination is not yet properly developed. We call it a non-myelination of the pyramidal tract.